couple of comments with respect to the military question, too, to follow up on what the governor said, is that the state lab is in active communication with the military establishments within Virginia, and we do offer and partner with them to provide testing in the event that they need testing. The request is that they work through the Virginia Department of Health to meet the criteria that we establish for all citizens of the Commonwealth. But if they need testing at the state level, we will provide them collection kits and access to state resources for testing if they needed it. The second question was, what is our capacity? Currently, the state lab has a capacity to test about 1,800 patients. That testing, it not only supports universities, but it supports anyone within the Commonwealth that works through the health department. So it supports corrections, supports nursing homes, outbreaks that might occur in institutional settings. So we do provide a very broad distribution of testing support where it is critically needed in Virginia. We have procured and have brought in high throughput instrumentation that we are evaluating at the current time and hope to be able to expand that testing in the next week or so.
You said high throughput testing?
It is, so right now, the current testing that we are doing is the CDC test that has been approved under FDA emergency use authorization. That is a test that requires manual processing, which means there's no automation, there's no robotics that allows us to do high-scale, high-throughput testing. We've looked into instrumentation that will allow us to process larger batches of tests at a single time, which would increase our capacity. Again, I can't overemphasize the supply chain issues that are limiting our ability to do higher numbers of testing. So they are across every manufacturer, every platform, every test system. And so we are experiencing that, as are all state laboratories and university laboratories. So that's something that we are all trying to navigate through and to have redundancy so that when one supply chain runs out or becomes back ordered, we can reflex and use a different test system.